Hello everyone, this is me, Ashima. Welcome you all to the series of our live sessions, Dil Dhadakna Zaruri Hai. Before we begin with our today's discussion, I would request you all to join us quickly and ensure us whether you can hear us properly or not. Behind the camera we have with us Vasundhara and Shakti, who will keep updating us with your comments and questions. So if you have any question regarding heart health, feel free to ask and leave your questions in the comment section below. We'll try to answer your question during this discussion. Today we have with us Dr. D.K. Jhamb, a senior interventional cardiologist with an experience of more than 30 years in this field. Dr. D.K. Jhamb is the director and HOD of Interventional Cardiology Department at Sanar International Hospitals. Welcome, sir.
Thank you, Ashima.
So, as we all are aware that our today's topic is why our young people are experiencing more heart attack, or we can say why our young population is at the risk of cardiac ailments. If we go through recent news reports, it's very disappointing to see how some of our young celebrities experienced severe cardiac ailments. Adding to that, rapid increase in such incidences is also one of the major concerns in major health concerns. So, sir, first of all, my question to you is: heart attack is something which is considered to be a part of aging, or we can say it is considered to be a symptom of deteriorating health among senior citizens. Then, why our youth is at such a huge risk?
Yes, Ashima, you are right. Heart attack was earlier considered to be a problem of the
Yes.
elderly. Coronary artery disease, the way we call it in our medical terminology,
Yes.
actually begins at middle age and goes on after that. So most people become symptomatic at a late age. But now the trend is changing, which is why we have to be more careful.
Yes.
The reason is that the lifestyle is changing.
Right.
We are all living a very fast life.
Yes, sir.
We have fast food and we try to do multitasking, do too many things, and at the same time, stresses of life, including multiple activities and multitasking, are adding on, taking the toll.
Okay.
Besides this, we must know that not all of us are similar.
Yes.
Different people have different risk factors.
Yes.
Some of the people may have risks which may be inherited
Yes.
or genetic,
Hmm.
and they know about it because they have a family history of heart disease.
Yes.
While,
Which should be more discussed about.
yes, you're right, while there are many others who may not even know about it.
Yes.
Because unfortunately, their family members or their peers or their siblings did not suffer of the problem, but the gene which was earlier under remission or not manifest has now become manifest in this individual, and this individual, being totally unaware, is taken by a surprise. So we have to be careful of how we live our lifestyle.
We have to be careful about our lifestyle. So, talking about such youngsters, we can see there are people who are actually aware about their health, like they are regular with their gym schedules. Even with we go through their social media pages, Instagram pages, they are regular with their exercise patterns, they are conscious about what they eat. Then where are we actually lacking?
Yes, this is what I'm coming to now, that we are actually reading about and hearing of and acknowledging that a lot of heart attacks are occurring in the young, where the young were actually careful also about their lifestyle.
Yes.
They were very regular with physical activity. They were slim, trim,
Yes.
not obese, not
Yes.
fat. And only thing is, we do not know whether they took care of
Yes, sir.
some of the known risk factors like high blood pressure,
Yes.
high sugar, and high cholesterol.
Yes.
Agreed that they took care of their body weight, maybe their diet also. They were very
Yes.
conscious of having a prudent diet.
Yes.
A prudent diet is one where a wise man knows what to eat now and what not to eat. There is very little to talk about it, but of course we'll still talk about it, and a lot of these things which we all know, basically we will revise through again
Yes.
over here. But what we do not know is that despite a good lifestyle,
Yes.
because of their stresses, multitasking, did they take care of simple things like their blood pressure, blood sugar, blood cholesterol?
Yes.
Did they ever go to a physician, let alone a cardiologist, to get his or her blood pressure measured?
Yes, sir.
Or if there were any symptoms, sometimes it may be asymptomatic also. Did they
Yes.
ever go to anybody to get the blood pressure checked? Did they ever do a simple blood test on a fasting blood sugar or a blood sugar 2 hours after a meal? Or did they ever get their fasting lipid profile and a few other risk factors that I will talk to you about as and how you may ask me
Yes.
the questions and I'll let you know. Did they ever get these things examined, investigated? Is a very
Yes.
important question.
Yes.
Maybe they did. And in that case, they took care of their various risk factors,
Risk factors. Yes.
including sugar, blood pressure, cholesterol, abstained from tobacco, smoking in all manner,
Yes, sir.
took care of their diet, were regular with their exercise, and were regular about their physical activity, maintaining their body weight. Then finally comes the point related to genetic and
Genetic
hereditary
risk.
risk factors, which they usually get to know from the family members, but once in a while they could probably the first ones in the family tree to get caught.
Okay, so there are many factors to be considered.
That is the word.
Yes.
True. So it is multifactorial.
Multifactorial.
Let's take
So-
care of as many factors as we can,
Yes.
and as we go through over these days and weeks,
Yes.
and maybe the month of World Heart Week,
Yes.
dil dhadakne do.
So this is the right time to discuss all these issues. So Vasundhara, do we have any questions from our viewers?
Right now we don't have, so you can continue. with
All
the
right, so we
question.
can continue with our next question. Sir, after witnessing these incidents, like you have already answered although, but there is a section after witnessing such incidences, they have opinion that even after this regular exercise schedule, people are experiencing heart attack. Why? Why should I? Why should I
Yes.
give it so much of effort?
Yes.
You know, is it wise to drop the idea of regular exercise or a healthy lifestyle? How do you answer
Now,
that?
you see, this is a very important point, and it's a very good note that you've
Yes.
raised over there.
Mm.
One should not be dissuaded by
Yes, sir.
few incidents.
Yeah. Like many people say that if it is bound to happen, it will happen. Why to take so much of risk? So
These incidences came into limelight and highlight because they were page 3
yes,
celebrities.
yes,
But
influencers basically.
But we do not know of what all is happening or not happening to others who are not on page 3.
Yes.
It is a minuscule 0.00000001% which will come on page 3. While there are, as we know, 130 crore other Indians and 6 times the number all across the world, out of which half of them are in the elderly age group
Yes, yes, yes,
and
yes.
are candidates to suffer of heart disease.
Yes.
So we should not let a few incidences like these dissuade others from pursuing a good lifestyle,
Yes.
maintaining a healthy diet, a prudent diet, a wise diet which is rich in fruits, vegetables, legumes, whole wheat products, and high fiber diet with less fat, oil, butter, ghee, cream, milk products, and cheese or processed food.
Yes, sir, definitely.
And be regular with physical activity, at
Yes,
least
of
put
course.
in, if not more, half an hour each day
Yes,
of
sir.
the week. On an empty stomach, preferably, so that one can exercise in the best manner that way, rather than after a meal. Maintain a body weight and thereby a BMI or a body mass index of 25 or less. Because 25 to 30 becomes overweight and above 30 becomes obese. Be careful of simple things, blood pressure, maintain it below 140/90 millimeters of mercury. If still high, despite the lifestyle, seek an opinion of a physician for
Yes.
it. Keep a blood sugar of below 100 milligram percent on an empty stomach, below 140 milligram percent 2 hours after a meal. keep the total cholesterol in the range of 150 to 180 milligrams
Yes.
percent, triglyceride below 150 milligram percent, the LDL or the bad cholesterol about 100 milligram percent or less,
Yes, sir.
and most important,
Hmm.
HDL or the good cholesterol, which we all overlook at,
Which is very important
is
also.
very important. It works as a cleansing agent.
Hmm.
Whatever bad and harm LDL and triglyceride do to the arteries,
Yes.
this works as a scavenger, as a safai karamchari of the arteries, and it removes all of those deposits, but only if it is in adequate quantity of 45 milligram percent or higher, which comes only with exercise, diet, and a healthy
Healthy
lifestyle.
lifestyle. So there are many contributing factors which actually lead to our heart health. So that's why even if we see an apparently healthy looking person experiencing heart health issues, we should know that we don't know about his underlying diseases, about his stress life, about his sleep cycle, or the stress management maybe. So stress management maybe.
And sometimes it would even be the use or abuse of other compounds
Yes,
that
yes.
may be associated.
Of course.
And let us not get into any controversy.
Yes. So hence it's surely not the wise idea, or wise to drop the idea of healthy lifestyle. Rather, we all should have a healthy lifestyle regime based on our different requirements. So, sir, as our as our hashtag is running on social media, Dil Dhadakna Zaruri Hai. What is your message to our viewers? Dil Dhadakna Zaruri Hai. How and why?
Dil dhadakna zaruri hai.
Hmm.
How? By a healthy, prudent diet
Yes.
and a wise lifestyle with regular physical activity.
Hmm.
And once in a year,
Hmm.
if not more often,
Hmm.
preferably 2 or 3 times in a year, but if one is not able to, at least once in a year, get a complete blood levels of
Check.
sugar and cholesterol checked.
Hmm.
Twice a year, have somebody check the blood pressure,
Hmm.
or do check it yourself using an automated
Yes, sir.
electronic apparatus.
Hmm.
And why? Because everybody has a life, everybody has a family, everybody has people
Yes.
waiting for him or her
Hmm.
at his house or place, and everybody has people who are interested in him or her,
Hmm.
and he is answerable to all of them. That is
Yes,
the
sir.
reason why.
Yes, sir. So thank you so much for sharing such valuable information with us, sir. So this is me, Ashima, and Dr. D.K. Jhamb signing off. Thank you so much. Dil dhadakna zaruri hai.
Dil dhadakna zaruri hai.